Thank you, Mr. Chairman. Good morning, Madam Secretary. I'm Chuck Fleischman. I represent the 3rd District of Tennessee. And to follow up on some of my colleagues' questions, we've heard numerous mentions of the Department's intentions to transfer funds from various accounts to implement the Affordable Care Act. I'm particularly concerned about your proposals to use $500 million more for ACA implementation than you previously predicted you would need, especially given your Inspector General's concerns about exchange implementation. You've demonstrated a willingness to redirect funds for your purposes. I have 2 questions. What changes have you made to support states that are looking at buying the expansion population into the exchange? And my second question is, will you be pushing back the exchange implementation to adjust for unforeseen problems that have arisen and that have led you to seek additional funds for implementation?
Well, Congressman, first of all, I think we have sought funds in the budget process. We sought funds in the CR process. Having failed in both of those efforts through the work of the United States Congress, we are then using the resources available within the Department to make sure we implement the law of the land. I'm not quite sure I understand your question about the states who want the expansion population in the exchange, but as you heard Mr. Womack say, Arkansas, which has a plan to use their Medicaid dollars to purchase coverage for individuals from a company offering coverage in the exchange and then provide wraparound coverage, we are working very closely with. We have not yet had a specific proposal from Governor Beebe around what their 1115 waiver would look like, but we're eager to get it now that the legislation has passed. I've had many conversations with Governor Haslam about his interest in that possibility. He's watching, I would say, the Arkansas situation closely. We have expressed an eagerness to work with him, outlining, what the law allows us to do and what it doesn't allow us to do. But we're working with a number of governors around the expansion population and what the flexibility for the states may look like.
Well, okay, but let me ask you a follow-up. Will you be pushing back the exchange implementation, though? Are you going to push it back, or what are your plans?
No,
okay.
sir.
Let me ask you a question, if I may, in the time I've got left, about hospitals and the bad debt situation. My question regards the administration's proposal to cut Medicare bad debt payments by $25.5 billion while asking for rather sizable funding increases in other parts of the budget. This cut to providers in and of itself seems to be particularly misguided at a time when Medicare already underpays hospitals, according to MedPAC, and when seniors in my district are struggling to make ends meet. But what I find most curious is the administration's rationale for the cut, and I quote, "This proposal would more closely align Medicare policy with private payers." I'm sure you're aware that the fixed price system under Medicare is completely disconnected from the private pay area where hospitals have the flexibility to negotiate. There is no negotiation today under Medicare's fee-for-service system. Government sets the price as well as the beneficiary cost share amount, period. May I respectfully remind the Secretary that the administration has stood in the way of repeated efforts to modernize Medicare and really align policy with private payers instead of paying lip service to it when you want to cut the hospitals but not grant them the same tools to negotiate what they now have in the private system. How can you reconcile this inconsistency?
Well, Congressman, I think that what has happened with Medicare over the past several years is we've been working very closely with private payers around the country, and they are extremely enthusiastic about the framework given to us thanks to the Affordable Care Act to begin to shift Medicare to a value-based payer as opposed to a volume payer. We are starting to implement a number of those changes. We're pleased with the 250 or more accountable care organizations, many of which include hospitals, which have now come together voluntarily to look at different ways to deliver care and actually share in the savings. We have hospitals really engaged in efforts around reducing hospital-acquired infections and other issues which drive up cost and lower patient care. So I think the framework around Medicare dealing with hospitals is very different than it looked 4 years ago, and in fact is, I think, moving in a very positive direction for patients and for providers.
Ms. Lay.
Thank you very much. Good to see you, Madam Secretary, and thank you for being